Hi, very good evening. Welcome to the FB live session. I'm Soumya here from VS Hospitals. So it's pleasure that we will be talking about approach to hearing loss. So hearing loss is nothing but, loss of hearing. Which we see most of the cases that have been from mild to profound, which is between the age group of 60 years. Older than 60, that is, the old age people, mostly they come across this kind of a problem. So when we look into it, I'm sure five people out of five, for men, they will be having this loss of hearing. And when it comes to the reports seen for women, out of 8 women, one will be diagnosed with loss of hearing. So this seems to be most common right now, and there might be multiple reasons for it. So we have Dr. Balaji on board, who will be able to help us out in understanding what it is, because he has been a pioneer, and he has his expertise in terms of treating a lot of patients who will be having this kind of an ailment. So understanding the causes for all this, going forward, the treatment for all these things, and how would we take care of such kind of patient is very, very important. So we welcome Dr. Balaji. It's a pleasure having you.
Yeah, hi, good evening all. Today we shall be discussing about the commonest causes for hearing loss from age group up to 60 years. Okay. Common causes or what people are expecting, we'll discuss today. Okay, thank you.
Right. So I was just wondering, so what is this hearing loss, and what are the different types of hearing loss we see, doctor?
Yeah, actually hearing loss is like basically you have conductive hearing loss and sensory neural hearing loss and mixed hearing loss. If a conductive hearing loss in பாத்தீங்க அப்படின்னா, it is like சின்ன வேக்ஸ்னாலையும் இருக்கலாம், இல்லைன்னா middle ear fluidனால இருக்கலாம், or அந்த மாதிரி ஏதாவது it is like a conduction, அதாவது வெளியில இருந்து அந்த sound is not able to reach the inner ear nerve. So that is a conductive component. Whereas neural loss is like the nerve function itself becomes reduced. So the nerve function becomes reduced. So patient will have a reduced hearing due to nerve communicating between the inner ear to the up to the brain. So that is sensory neural hearing loss. So, but commonest type we are seeing a lot of conductive hearing loss because of the issues in the external canal and middle ear. So basically, ear it is divided into outer ear, middle ear, and inner ear. Anything related with the outer ear and middle ear is we did think about conductive hearing loss. Anything involvement in the inner ear, we think about sensory neural hearing loss.
Okay, all right. So that was briefly explained. So can you help us understand the different factors that would contribute to this hearing loss?
Oh, it can be from, for example, as I told you, as we divide ear into outer ear, middle ear, and inner ear, there are a few causes. I'll discuss. We shall discuss on the commonest cause which we experience in among our public. The thing is, the external ear, we think about wax. So wax. The most commonest thing is the thick impacted wax blocking the ear. Next thing is you can have a fungus, kalan. You can have a fungus in the canal. Next thing is tympanic membrane perforation, that is called jugular water. So the what I told you, the first two causes is basically a conservative management. We can treat it medically. Okay. Whereas the tympanic membrane perforation or the called jugular water, it is like if it is acute, we can manage medically. When it is chronic, it has to be treated surgically. So these are the commonest cause. But if you treat it immediately, the thing is, it is easily manageable and it is very conservative.
Understood. Okay. So what are the different degrees of hearing loss, doctor, you would say?
See, you have various degrees of hearing loss, starting from mild, moderate, moderately severe, and profound and total. Oh. So these are the various grades of hearing loss, which we document based on pure tone audiogram. We grade the level of hearing loss, and based on the degree of hearing loss, the management differs. For example, if it is mild, moderate, patient can be like normal without any management because it is they don't need any kind of hearing loss. If it is like profound hearing loss, severe hearing loss, patients' communications becomes very, very less. So what will happen is they need a help of a hearing aid for communication. See, basically, hearing is not only for communication, it is for the protection, self-protection. Sometimes something may fall from above, behind, honking sound in the road. We tend to move or escape from the danger. So you should not consider hearing is only for communication. It is, I always feel hearing is for communication and self-help. Like you need to escape something. So you should not think not only for communication.
Right, right. Absolutely agreed. Because there were been instances where, there are many people who tend to have a damage caused for themselves because of, loss of hearing, which mostly it happens with the old age people. So as you rightly said, it's for self-protection, which is very, very important, as you have quoted. So what are the signs and symptoms you would say that the adults and the children will have when it comes to hearing?
I'll tell you my experience for the past 2 years during COVID time. See, during COVID time, we would have seen all people having online classes and work from home. The thing is, during this period, I was having a lot of students coming to my clinic, like because they were all using headphones. So during the period of headphone usage, the parents that time the students were able to know that their hearing for 1 year is very less because they were using headphones or to support online classes, headphones. So during that time, then people accidentally identified that they have a hearing loss on one side. So the thing is, during this time, we were able to identify a lot of hearing loss for many people. And the thing is, young females, there are a thing called otosclerosis. What do you mean by otosclerosis is there are 3 bones in the middle ear. So one of the bone may not move during communication. So the thing is, that is called otosclerosis. That is very common in young females and adults also. And the next thing is, during COVID, we had a lot of middle ear infection. So middle ear infection produced a lot of perforation in the tympanic membrane. So when there is a lot of perforation in the tympanic membrane, again, the thing is the management, like initial period, if it is managed immediately, we can manage conservatively with antibiotics. But if it becomes chronic, again, the treatment becomes a surgical treatment. So the thing is, you have to identify the hearing loss early. அதே மாதிரி there is a thing called sudden sensory neural hearing loss. அதாவது எப்படின்னா முன்னாடி நாள் வரைக்கும் நல்லா கேட்டுட்டு இருக்கும். They will be hearing normally. Suddenly one fine day, their hearing will be lost in 1 year. So that's called sudden sensory neural hearing loss. Okay, some people they think that it is like the common cold, so we can get managed after a few days, after 10 days, after 15 days. But if that condition is not managed within 3 or 5 days, you will lose your hearing. Okay. So you have to be aggressive in treating sudden sensory hearing loss, which many people they think like it is like a common cold. So we will treat it after some time. So if it is not treated immediately, they will be losing the hearing within 5 days.
Okay. Okay, so that is a dangerous part, right? As you said. So people be very careful. So you have to be cautious when you have that sudden hearing loss, and make sure that you meet your physician, your ENT doctor. Let's not be negligent on that part, as doctor rightly said. So thank you for that. So doctor, when it comes to hearing loss screening, like how do we screen and how do we diagnose that?
Yeah. See, regarding screening, like for example, nowadays, right from newborn to 60 years, hearing has to be screened. For example, nowadays, immediately after childbirth, we do ear screening, that we do all the measurements to know the level of hearing. And every year, it is better to screen the level of hearing loss. Sometimes there are a lot of people working in industrial environment or people working in loud areas. Those people definitely needs regular audiological screening, because chronic exposure to loud noise will have a definite loss of neural hearing loss. Again, nowadays people they tend to hear a lot of music, loud noise in the headphones. So the thing is, we keep hearing loud noises. So again, that causes loss of sensory neural component in the hearing. So it has to be regularly screened. First thing is, we should know whether our anatomical area, that is external canal, is normal or not. Once external canal is normal, next thing is we need to we should know the level of hearing loss. Again, it has to be screened. That is very cheaper also. Again, it's not costly. Hearing screening is a very, very cheaper thing. It's not a costly thing at all, which every people must have a hearing screening every year. Better to do.
Okay, okay. So that was a nice suggestion, doctor. So what are the tests involved and the latest treatment options available for this?
Yeah. See, first thing is hearing screening starts from a clinical examination. So first thing is the doctor, ENT doctor, we will be examining the ear canal, whether there is any abnormality in the external ear canal. So for example, if you can have a fungus, again, as I told you before, if you have a fungus or if you have a bacterial discharge or if you have a wax, you cannot screen your hearing with a measurement, with an instrument. So first thing is you have to clean the extra-auditory canal. Next thing is you will be subjecting the patient for a pure tone audiogram. The most commonest thing what we do is pure tone audiogram and impedance audiometry. It is also very, very cheaper, again, as I told you before, because it is the best tool to assess the hearing. So we can measure whether the patient has got a nerve loss or a conductive hearing loss, which I told you before. Which can easily find out whether it is a conductive hearing loss or sensory neural hearing loss. And clinically, ENT doctor it will be very easy to diagnose with the help of tuning fork alone, but that will not be like a measurement. So better to do a pure tone audiogram and impedance audiometry when it is suggested by a ENT doctor. It's better thing.
Okay. Okay. So people, that, as doctor said, there are tests available which is not costly and it is much more affordable, which can also help you diagnose your hearing loss at a very early stage, the level of hearing and all can be screened. So as sir said, I'm sure all of us can take an advantage of that. Let's not delay on that part, because prevention is better than cure. That is something we believe in. So having said that, doctor, is there any complications in treating hearing loss?
Yeah, see, basically, as I told you, hearing loss can be treated in a conservative way and in a surgical way. Conservative way, I mean to say by giving medicines, and surgical way is doing by surgery. So when you're treating a hearing loss in a conservative way, when you give antibiotics, like you will have a minimal side effects as by any other medicines. Okay, right. That is only if the condition is treatable by medicine. Okay. As I told you, there are hearing loss which can be treated only by surgery. So in that case, the complication is very less in an expert hand. So definitely, as and by other surgery, there is a complication. Always there is a complication, but with the expertise hand, the complication is very less. So it is always manageable. It's not. Not.
So can you educate us on hearing loss prevention?
Yes. See, that is very, very important.
Yes.
See, we all use cell phones. We travel in car. We hear a lot of loud noise. We see a lot of movies. So let me start from our home. See, we use cell phones, we use headphones. Nowadays, people are using a lot of headphones with high volume voices, high volume noise. So the thing is, when we keep using a high volume noise, what happens is we lose our nerve component. Definitely, we will have a nerve loss. Next thing is, we keep using wax. So we keep using cotton buds. We use cotton buds. During cotton buds, this is the most commonest thing which people do. Usually wax get collected in the external ear. So people feel that they are cleaning the wax. Actually, they don't clean the wax. They push the wax deep inside the canal. So when they keep pushing the wax deep inside the canal, what happens is this wax from our external part of the ear, it goes and pushes into the tympanic membrane. Again, the people, they create trouble by using earbuds. So actually, we see a lot of patients having a complication because of the use of earbuds. So they push the wax from the external canal deep inside the tympanic membrane, and it gets infected. Again, the buds usage causes fungal infection in the external auditory canal. So the worst complication which I daily encounter is the usage of cotton buds and cleaning, because they keep push the wax deep inside. Next thing is loud noise hearing while using car or because they keep a loud noise. The volume is always on the higher side, because when we travel in car, again, that is the worst thing. And many functions and many functions in our routine practice, they use a lot of high volume speakers. So basically, like conserving our vision, we need to conserve the hearing also. So the entire world, they dedicated one particular year to prevent hearing loss. So the thing is, we have to conserve our nerve, because since there are a lot of people using headphones now, in future we can anticipate a lot of nerve loss in future from younger age group people. So definitely, I'll advise them not to use loud noise. They have to prevent the loss of hearing in future. And again, I told you regarding the earbud usage, it should be very cautious, and there are a lot of complications more than a medicine using of earbuds.
So that was very helpful information that you, doctor. Appreciate that. So is the surgery only an option to treat hearing loss?
No. See, again, I told you, when there is a sensory neural component, that is a nerve involvement in the hearing loss, the treatment is basically hearing aids. So if there is a profound hearing loss or severe hearing loss that is involving the nerve, the treatment is only the hearing aids. Whereas there are a lot of patients with tympanic membrane perforation, jugular water. So jugular water or tympanic membrane perforation, it is treated basically by surgery. So we take a small fascia from it's called temporal fascia, or we take a cartilage and we keep it to close. We use it to close the tympanic membrane perforation. So that will be the safest surgical procedure, which can help in preventing the hearing loss again, because they will have a chronic discharging ear. There are a lot of complications when there is a perforation. The infection can go above the brain or down, it can come to the neck. So to avoid further complication, better to close the tympanic membrane perforation. So definitely that will help in hearing also. That's a safe. Again, I told you, as any other surgery, it has got a complication. But the thing is, in expertise hand, you can always do it very well. So the patient will come out very well.
Right. So that's rightly said. So how effective is the treatment, and why is it important to treat the hearing loss?
Yeah. See, again, I told you, when you are treating the hearing loss, you are not only giving a better communication to the patient. Again, I'll always say it also is a safety measures also. So we all know that this patient has got a severe hearing loss just because of the tympanic membrane perforation. The thing is, first thing is the patient will communicate better with their family, with their relatives, and the patient will have a inferiority complex in their working place also. So yeah, it is absolutely a very big issue. I have seen a lot of people working in a working environment. They feel a lot of inferiority complex in communication just because they are not able to hear. And I've been operating a lot of people who are working people. I'm operating, and they feel confident after establishing a better hearing. So again, I tell you, it is not only for the hearing. Again, it is for the self-protection also. When you're improving hearing, the person becomes more protective. They can protect from the environment. And the next thing is psychologically, it gives a very good feel for the particular person, because you feel that complex. So when you speak better, when you communicate better, their complex becomes they become more confident too. So you establish a patient's confidence. So that is a major part. More than hearing, the patient becomes more confident in communication, in work schedule also.
All right. So agree. So when it comes to dealing with the emotions of hearing loss, as you said already, that it is about the inferiority complex. So what are the other emotions that are connected to this? Like, how do we deal with those?
See, basically, you have to discuss with the patient. I have seen a lot of software people, many people working in the corporate sector. Sometimes they will have a severe hearing loss just because of the tympanic membrane perforation, and they will feel like inferior to wear a hearing aid also. So they will not be, they won't be comfortable wearing a hearing aid when working in a corporate area, working in a working environment. So they will feel like once you give a better hearing, the thing is, I will give them two options. One is whether you can go for hearing aid. Next option is you can go for surgery. The patient themselves, they have opted surgery because again, even though you give a better hearing with a hearing aid, they don't feel that the stigma. They don't feel comfortable with a hearing aid. They tell me, sir, you proceed with surgery. So I have done a lot of surgeries for those patients. Again, so you improve your confidence level, you improve your communication. Again, your work pattern becomes very good. When you improve your hearing. And again, psychological stigma, you become more confident in the family also. I have seen many elderly patients who are like who feel inferior, who feel psychologically inferior even in their family also, when they are not hearing better. Even because when they are living in a family, they feel psychologically inferior when they have a reduced hearing. You give us confidence too if you give a better hearing.
Okay. So, so when should one consult an ENT surgeon?
See, I tell you, as soon as a person, that is, as soon as a person or as soon as a self, he feels, and if he feels any blocked feeling in the ear, it is better to meet a ENT surgeon. Again, I told you, just a common cold or an upper respiratory tract infection or mere blocking sensation. Sometimes, if it is prolonging or if it is lasting for more than 3 days, better to consult. If the blocking sensation or hearing is improved within 3 days, it is not that they should immediately go to ENT surgeon. If they feel the blocking sensation is prolonging for more than 3 days, better to treat immediately, because you can easily manage conservatively with medicines without surgery.
Correct. So that is very important. So, Doctor, this was very helpful for us to understand, about all these areas that we have spoken about. So, what is the take-home message that you would like to tell?
My take-home message is you have to preserve your hearing. So don't abuse your ear by hearing loud noise. Next thing is don't keep using earbuds or don't keep cleaning your ears with any other objects. So preserve your hearing for your future. Just like preserving your vision for your future, you have to preserve your hearing for the future. We have to be like hearing better.
So that was wonderful. So viewers, look at that. I mean, there is so many things that we have heard from doctor, and the basic thing of using an earbud, that is something which we do as soon as you have a shower and come out. Many people have that practice of having an earbud and cleaning it and all. But the way it impacts us is very, very crucial, and we have to take care of that. And especially children or adults listening to the loud noise and ignoring the sudden hear loss, all these things we've spoken about. And it is very important that we do take care of ourselves and be self-conscious about it. It is, as doctor said, it's not about the communication alone. It's about your inferiority complex. It's about your confidence levels. It's about how you function your day-to-day routine life, just like other people. Rather than having a hearing aid and going around, it's always better that we take care of ourselves, and prevention is better than cure. So let us all be cautious and have an annual checkup done. As sir said, it is reasonable. It's not costly. It's not that you need to, shell a bomb to take care of that. It's just an annual checkup with a very reasonable rate that you can definitely go to a nearby hearing aid center and get it done. Meet your ENT doctors and get their opinions. So don't ignore yourself. Please do take care. It was such an honor and privilege to have Dr. Balaji here on board and explaining us. So thank you so much for your time.
Thank you so much.
Thank you. So viewers, thank you so much. So have a great evening and take care of yourself.
Thank you so much.